Hello everyone, I'm Alyssa Deno and I am currently studying nursing. The title of my article is New Outlook on Type 2 Diabetes. I wrote this article envisioning that it could be published in the American Journal of Nursing. The focus of this journal is to promote excellence in nursing and healthcare through dissemination of evidence-based, peer-reviewed clinical information and research, discussion of relevant and controversial professional issues, and promotion of nursing perspectives to the health community and the public. The community targeted by this journal are people trained and educated in the nursing practice. This community has similar education, common morals and beliefs about healthcare, and seeks to keep updated on current nursing practices. I chose to imitate many of the rhetorical conventions of this journal. I believe that it was important to stay formal and informative because this journal is written by educated people who are trying to communicate research, facts, and evidence. Along with this, I chose to appeal to logos through statistics and analysis, as does the journal. I also followed the format of the articles in the journal because they were precise and clear, and I felt that this added to the formal tone of the journal. I decided to also follow the compare-contrast strategy since I think it is an effective way to get a claim across by comparing current treatment to new research. However, I did not find it necessary to use graphs and tables since I was merely incorporating some of the facts into my paper. I knew for this article I wanted to talk about something relevant to the healthcare field and nursing. I decided on type 2 diabetes because it is quickly becoming an epidemic. As you can see in the picture, currently at least 1 out of 3 people will develop the disease in their lifetime. Type 2 diabetes is the result of not enough insulin being produced or the cells in the body becoming resistant to insulin. I chose to focus on the treatment of type 2 diabetes. To start my annotated bibliography, I first looked up current treatment guidelines for type 2 diabetes. The current guidelines for treatment provided by the American Diabetes Association is like a ladder. As each step of treatment fails, the patient moves on to the next round of treatment. Since type 2 diabetes is being treated like a chronic disease, I decided to look up the definition of one. The article by Bernal and Howard states that type 2 diabetes is a chronic disease because it is persistent for more than 3 months, it usually has a long development period, it cannot be cured or disappear, and it creates further complications. As you can see, this treatment plan is made for a chronic disease. It starts with lifestyle changes, and as the disease progresses, more and more medications are tried until the patient ends up on insulin. However, I found research that shows that type 2 diabetes can be cured. Pierce states that if a patient is willing to lose 15 to 20% of their body weight and keep it off, there is a very good chance of their diabetes being cured. Potentially within weeks, a diabetic patient could be put into remission. In the study done by Stephen et al., the effects of a very low-calorie diet were observed in 30 individuals when they stopped all oral anti-diabetic meds and insulin and began this diet. I decided to further look into the treatment of type 2 diabetes and found this study by Harrison et al. In this study, 58 patients newly diagnosed with type 2 diabetes who had not yet been treated started a 3-month lead-in period where they were treated with metformin and insulin. Afterwards, the group was split up into 2 groups, one that continued the metformin and insulin, and the other started a triple oral therapy regimen of metformin, glyburide, and pioglitazone. Beta cell function was preserved in both groups for at least 3.5 years. My research question became, should type 2 diabetes be treated as a chronic disease or as an acute threat to health? And my research led me to the thesis statement that new research and studies are showing that there is reason to rethink the treatment of type 2 diabetes. Instead of automatically treating it as a lifelong sentence, type 2 diabetes needs to be looked at as an acute threat to health. I was writing to show that current treatment is laid out for a chronic disease, while current research is showing that early and aggressive treatment is better and can even put the patient into remission. After introducing my topic, I started my article off by pointing out problems with the current diagnosis and treatment of diabetes. Prediabetes is a diagnosis for the in-between people. Their blood glucose level is too high to be normal, but not high enough to call them a diabetic. The problem with this, as Cheryl Himmelfarb states, is that it gives a false sense of security and a reason to stall treatment. Cheryl ran into this problem while making the new guidelines for hypertension treatment. Prehypertension was a diagnosis that gave patients that false sense of security. Therefore, the new guidelines were changed to rule out a prehypertension diagnosis, and if a patient's blood pressure is above normal, treatment is started immediately. This same attitude should be put towards diabetes. Besides diagnosis, there is also problems with treatment. The prolonged ladder approach creates clinical inertia. This means that as interventions fail and the patient climbs the ladder of treatment, their HbA1c levels may be over 8% for up to 2 years. Diabetics should be less than 6.5%. These elevated blood glucose levels have devastating effects on the body and make treatment less effective. It is important to address what shaped the current view of type 2 diabetes. The current view of diabetes was shaped by large studies that showed an increasing need for hypoglycemic agents as diabetes progressed. However, progressive weight gain occurred during these long-term observations, and hence type 2 diabetes is irreversible only during chronic positive calorie balance, which could mean type 2 diabetes is solely a response to overnutrition. Therefore, a key treatment is weight loss, which can effectively be accomplished through very low-calorie diets and bariatric surgeries. These interventions have been known to cure type 2 diabetes. For these reasons, I decided to talk about the very low-calorie diet in my paper. In this study done by Stephen et al., the diet consisted of liquid diet formula, non-starchy vegetables, and calorie-free beverages, which meant about 624 to 700 calories a day. 12 out of the 30 participants achieved a fasting blood glucose less than 7 millimoles per liter, which is considered a controlled blood glucose level. This study showed that treatment did positively correlate with the duration of diabetes. 9 out of the 15 short-duration diabetics, meaning they had been a diabetic for less than 4 years, were responders compared to those who had been diabetics for longer than 8 years, in which only 3 were responders. This confirms that early aggressive intervention is needed to treat type 2 diabetes. Another intervention that proved to put diabetics into remission was bariatric surgery. Buzga et al. Evaluated 74 patients with type 2 diabetes who underwent laparoscopic greater curvature plication, laparoscopic sleeve gastrectomy, and Roux-en-Y gastric bypass. 82% had reduced medication use, and 39% had stopped them completely. 50% of the insulin users stopped using insulin completely, and remission was achieved in 8 of the 10 patients for whom data were available. Therefore, the hypothesis that type 2 diabetes will improve over 12 months after surgery, along with reduction of pharmacological intervention, could not be rejected. Although remission had been proved, early and aggressive treatment in general provides better outcomes for diabetics even if remission is not achieved. Harrison et al. Stated that the shorter the period of glucose toxicity, the more likely that full recovery of beta cell function will occur. Thus, early and sustained interventions have the best chance of preserving beta cell function. Patients want to preserve their beta cell function because once that is lost, glucose regulation becomes much more difficult. Nurses are important resources for diabetic patients. One huge aspect is education. Nurses must be aware of treatment options and how to educate patients. They are also needed for support and encouragement throughout these treatments and inform them about the benefits of slowing down the progression of diabetes and the possibility of remission. Hypertension, retinopathy, neuropathy, nephropathy, infection, etc. are complications that occur as diabetes progresses. Early and aggressive treatment can slow the progression and even put the patient into remission. Only when these initial aggressive treatments fail should type 2 diabetes be looked at as a chronic disease. If you know anyone with type 2 diabetes, encourage them to be informed of all their options. It is time to stop automatically treating type 2 diabetes as a lifelong symptom and start giving these patients a real shot at slowing down their diabetes and possible remission.